All right, we're back for Sapien Light, our mini episodes in between the nice studio episodes. Check this out on YouTube. I'm wearing my mitochondria shirt.
Marty,
We got Dr. Gary here. How's it going?
it's going well, Brian. It's been another heavy week. The clinic is busy, 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 and it's still very much driven by a lot of the fear and the issues related to COVID, and it's not getting better. If I'm going to be honest with everyone.
Yeah, well, we got to talk about it. We've talked about COVID before. We have some controversial thoughts. We're also talking about, being safe and not being crazy. And Dr. Gary's seeing a lot of these people dying, getting sick. He's also seeing the mental fallback and a lot of other sides to it. So, yeah, we love to have these conversations that bring more context. And I guess I'll let Dr. Gary tell us what he's seen lately.
Yeah, look, I think a lot of people really thought that, come the election, things would really change and people were really optimistic about 2021 being different. I think that the tough pill for everyone to swallow is that it's not different and it's not really getting better. I think that, there's less media coverage about COVID. I think everyone sees that. And what is it, the middle of February right now? And all of a sudden, instead of a death count ticker and a case count ticker, you just don't see that, and you're just hearing about some other stuff in the news cycle. But
Wait,
the
that's really, I just want to point that out because, yeah, on CNN, people point this out online. It's like every day there was a death count ticker. The minute Biden gets into office, no death count ticker anymore on the CNN stuff. Huh?
Yeah, and look
Interesting.
on most media channels, it just seems like it's not that they're minimizing it; they're just not talking about it. And I think in our last podcast we talked about how we don't support the lockdowns, and we think that there's a better way to handle this. My biggest concern with what's happening now is you have this political change, and instead of shifting gears and really giving people guidance and giving people support to how to deal with this like new world we're in, there's no discussion about it. There's no discussion about what does the future look like, what can you do to be healthier, what can you do to be prepared for COVID. They don't talk about the vaccine except go get it, right? No one knows really what the vaccine is going to do for them. And I think there's a ton of misconceptions when it comes to the vaccines. And again, I'm pro-vaccine. I think vaccines are great. I think there's, definitely some controversial ones. I think there's definitely some, ideas that people that are anti-vax bring up that are meaningful ideas. But, I think that for people right now, their expectation is that they get the COVID vaccine and they're safe, right?
Mhm.
Or now they can live a different life. And I think even as people are getting the vaccine, they're realizing you still got to wear a mask, you still got to social distance, you still got to be really cautious, because what the vaccine doesn't do, it doesn't decrease transmission. It doesn't mean that you can't carry the infection and pass it along to others. So it really, on a societal level, doesn't change that much. We think that the vaccines can decrease death, and we certainly know that the vaccines decrease symptoms. But one of the reasons why people are suffering is that we have put our society in this like environment where people are not interacting with each other, people aren't leaving their homes, people are scared to travel, people are scared to see their loved ones and their friends. And I think that the vaccine doesn't change that. You know what I mean? It actually it protects you maybe a little bit. And now with all these new variants, we're not sure how effective they are with those new variants. So, I think people were very excited to see the vaccine come out. They were excited that it was going to change something. And unfortunately, I don't think it changes that much. You still see outbreaks in nursing homes. Um, and that's scary because those are the most susceptible people. You still have to be really cautious when you're having large gatherings because, the vaccination rate is really, really low, and we don't know how much protection it really confers. So I think the message I would want people to think about is that it's now been almost a year. People are stuck in their homes and they're fearful. And they're not getting more education about how to deal with COVID. They're not getting more education on how to deal with their mental health problems. Suicide rates are through the roof. They're not talking about that either, but they will, because it's going to be astonishing how many people are hurting themselves, being admitted for mental health issues. We're seeing higher and higher prescriptions of psychotropic substances to help with anxiety and depression. And what we're not seeing is more support for mental health. And I think that like we said in the original episode about COVID, the real fallout of COVID stands true. The side effects of lockdowns, the side effects of everyone wearing masks and being afraid of each other, the side effects of these politics where people are us versus them mentality, it's creating real anxiety. It's creating a lot of agoraphobia. I never used to see agoraphobia. It was something that people, you learned about in medical school, and it was kind of a rare thing. Agoraphobia is when you're afraid to leave your home. I see that regularly. I see it multiple times a day in clinic. People haven't left their homes. They're afraid to leave their homes. And the problem with that is maybe transiently, that's okay, but we're a year in and there's no end in sight. And as people are seeing that, they're getting more and more freaked out. And we're not building systems. We're not supporting healthcare providers. We're not creating mental health support services. And people are suffering. People are really, really suffering. And as a physician, as a primary care doctor, I feel like there's only so much I can do for people. I think our Sapien recommendations, our Sapien lifestyle is something that everyone can do. It's free recommendations and free interventions. Supplementation has not been amplified when we know that supplementing with things like quercetin and vitamin D and vitamin C and zinc is so powerful. And again, there's no public health push for that. So again, we're missing an opportunity, and we're further going down this mental health debacle.
Mm-hmm.
And it's really, really sad. There's only so much we can do. And, I think this platform, our podcast, and the whole Sapien organization is to educate people and empower them to take control of their health. I really wish our public health officials would get behind something like this, because it will empower people. It will help people with their mental health, their immune system, and they can still get a vaccine. But there's more that you can do to protect yourself and to be ready for what's not going to change, which is COVID's not going anywhere. It's still killing people. It's still circulating in our community, and now there's new nasty variants coming out, and that we're still just learning about. So it's a lot of issues. It's very complicated for patients to get their heads wrapped around this stuff. And I honestly, I spend most of my clinics now just trying to educate people and support them. And it's exhausting, but it's what we have to do because people are struggling.
Yeah. So you brought up many things. Maybe we can dive into some of them, but the mental health part is huge. And you talked about how you've seen such a rise in just your clinic. And, you talk to your colleagues, and they're seeing it as well. And we're also seeing worldwide statistics about it, nationwide statistics, suicides, all this type of stuff. But that's a very tangible thing that you're dealing with. And the main point I wanted to highlight is we're not saying to just say everyone can go back to normal or throw away all these suggestions of wearing masks or social distance or whatever. No one's saying that, because whenever we say this stuff online, we're like, hey, let's talk about our immune health. Let's talk about diet and lifestyle. People are like, oh yeah, right. Like or like, why is no one talking about it? They're like, well, they're telling you to social distance and do masks. I'm like, why can't you do both? Like it's insane that it's been this long, and they can do both. No one's doing both. No one's saying both sides.
Well, some people are, and those people get COVID and don't have a bad time with it because they're healthy. I think that
well, no, you're talking about like influencers or like specific doctors or health people online do, but no public officials are talking about it. That's the main thing we rail against constantly. Is it's been a year now. People could have changed their life in that year, and they didn't talk about it. And they just told you it's the same thing as the allopathic medicine model. Just put a Band-Aid on it, and instead of doing something you can control. But okay, another big point is that we're talking about the vaccine. So a lot of people are confused about it, that it's going to help stop transmission. when it doesn't. They don't claim it does that. It will make symptoms less in older people, and it could help with those outcomes. But so what that means, I'm not saying it's good or bad. What I'm saying is that means that COVID's going to be around, right? Like you said, it's here to stay. So that's why you have to tell them the lifestyle interventions. And that's why you can't lock down society. If it's here to stay, and we see that lockdowns don't even work, and there's tons and tons of good data. There's 23 studies that came out worldwide. There's all this content that we talk about that Ivor Cummins puts out, and he interviews all the real experts, the global experts on this. So the lockdowns don't work, and there's no reason for them, because I don't get it. Like, are you going to lock down forever? Like 20 years? It's like the flu. We still have the flu. It seems like this is what's happening with COVID. It's like, we have the flu, it's here to stay, and we just have to deal with it better. And some people deal with it better than others, like myself. By getting healthy, I don't get the flu anymore. I don't get the cold anymore. I don't get the common cold, any of these things, because I changed my health. And if we know that this is here to stay, and that the vaccine doesn't magically change everything, and it's like this magic wand, then it goes away, well, then why are we still locked down? Why are we still doing all this? We have to have a normal society, and we have to get community immunity, this herd immunity, and getting people that are not vulnerable to get it and pass it. And now they have these antibodies and this immune response and T cells and all this type of stuff. That's a solution, but no one's talking about it.
No one's talking about it. And while the lockdowns are starting to be pulled back, it's not like they're also giving people guidance on what it looks like now to get back into the community. Again, the lifestyle recommendations we provide are the things people should be doing as they're getting back into the world, right? So if, here in Los Angeles, they opened up restaurants, at least for outdoor dining, and so people are starting to go there. Those people should be also trying to eat healthier when they go out. They should also be supplementing. They should also be exercising. They should also still be participating in social distancing and appropriate masking strategies. It's a dynamic thing that requires multiple interventions to get back to normal or some sense of normalcy. And what we're doing is saying yes or no to this or that. It's black and white. Mm-hmm. And I made a post about I have a company that does testing for productions, because productions need to get back in business and they have regulations to do appropriate testing. And I got so much heat on my social media for it. And it's like, it's not all testing is bad or everyone needs to get a test. It's not black and white. There's appropriate use of testing, just like we've been testing for the flu for decades, right? And it helps you decide, hey, I'm flu positive, I should stay home, I'm infectious, I don't want to pass this thing around. That's how we should use testing. But again, no education on appropriate testing. It's just, there's more cases, there's less cases. And they don't talk about what the PCR test means. They don't talk about what an antigen test means. It's just very, very ambiguous and mysterious to most people. And so what you get is this yay or nay. You have people that are like, all testing is bad. I can't believe you're promoting testing. You're supporting the system that's evil. And it's like, no, I'm supporting appropriate testing. I'm not telling everyone to go get a test every day, right? I'm telling people that, hey, you're going to go work in a group environment. It would be probably appropriate to test people to make sure they're not having an infection before they go and work in a large group, right? So it's just a thoughtful approach to dealing with COVID that we're lacking. We're just either fear mongering or we're minimizing and distracting. And the problem with both of those things is it just creates a culture of fear. And that culture of fear leads to depression, anxiety, insomnia. People are having mental breaks. People don't know what to do. And where does this end? Like, at what point do we start saying, oh my God, we should do a public health campaign for obesity, since that's the #1 risk factor. Oh my God, we should create protocols for nursing homes and give guidance. Although I hear that might be coming down the pipeline. Like, it's February, pipeline, like, let's go. What do you mean? Mm-hmm. Like, what is how can you delay this? So it's just disappointing that we have terrible public health policy that is not robust, and it's not supporting people. It's just trying to uh, create more and more anxiety and fear. I don't know if it's trying to do that, but that's the result of what's going on. Um,
Well,
yeah. uh,
well, we should talk about the inconsistencies. So these are the other problems we've had. So we started talking about the politics stuff a little bit in the beginning, but specifically, it seems very political, especially in Los Angeles, when we open up right when the office changes of the president, and right when we have Gavin Newsom being recalled, and he's like, "Oh well, let's open up." And what we've seen the numbers of how many hospitalizations there are now compared to when December when we had this new lockdown, and there's way more now. So it's so inconsistent. There's way more hospitalizations. They're trying to say, "Oh, it's for the ICU. We got to protect the ICU," and now I'm going to open up. And then I'm just surprised people don't see through this stuff so easily when it makes no sense. They say they're basing on numbers. They're hiding the numbers. They actually stopped sharing this with California. They stopped sharing it. So I just have
and
a big
they
problem with that.
also manipulated the PCR test. So the PCR test is our sort of gold standard test. Um, I've described this before, but it's important to re-emphasize this. What is the PCR test? We put a swab in your nose, and what we're doing is we're trying to pick up a piece of genetic material from the virus, and then we amplify it using reverse transcriptase. Um, what is the problem with that? Well, it's not necessarily reflective of an active infection. So the amount of times you run that amplification will increase the positive rate. So if you just keep running, I think they were running 40 cycles last year, you get a lot of positives, because if you had the infection 3, 4, 5 months ago, you might have a little bit of the genetic material in your nose. And that doesn't mean you have an acute infection. It means you have a little genetic material in your nose. You have a lot of genetic material of a lot of different viruses in your nose. So if you just start amplifying and amplifying and amplifying, you're going to get positives. But does that reflect an acute infection? Because that's really the interesting question, right? And so we had these crazy high numbers. Everyone's positive, right? Then just recently, they dropped that threshold. So they're running the amplification less times.
To
And
30. Well, this is what people have been saying the whole time, that you should be doing it at 30. And now we go a whole year when they're trying to pump up all these cases, and then magically it's like, "Oh yeah, we're wrong the entire year. We can't do 40. That's too specific. It's too much, too magnified. Let's do 30." And now cases are going away.
And that's important. Like, so lab work in general, there's normal values, and then everyone has their own normal. So by changing the quote unquote normal range, you're able to manipulate the results. So something in, parallel there is like with vitamin D. I consider a normal vitamin D level 50, 60, 70. Our normal is 30 or above. But that's not normal. That's just for a variety of reasons, which we've talked about in previous podcasts. That's just what they've decided is normal. They actually looked at like the average population's vitamin D and said, okay, well, the average person is right around 30, so we're going to call that normal. The average person is vitamin D deficient, so
Yeah.
like more vitamin D deficiency, because that's what we're driving. That's the number that's driving the recommendations on supplementation and sun exposure. So similarly, when you change the way you do the test and you change the quote unquote normal value, you have different results. So are there actually less positive people, or is it just the test is indicating less positives? And why wait? Like, why did that just happen right after the election? So, we don't get too political on the show, but I mean, there's just no way we can't see the parallels between a change in office and then a change in all of these policies and a change in the media, sort of presentation of all this stuff. And it's dangerous, because whatever is actually going on, when you manipulate the optics of this stuff, you create even more distrust and fear, right? So yes, they don't have a death count ticker, and they don't have so many positives, but now people are like, well, what the hell happened? Should I be worried still? Should I not be worried? Are we done with COVID? You know,
Or you just lose trust in the whole system.
so you know, the media has a responsibility, and our public health officials have a responsibility to educate the public, and they're not doing that. They're just sort of posing and sharing whatever information they deem relevant at the time, whether that's politically driven or whatever. You know, it's pretty clear that the whole time they've been manipulating the optics of COVID, and that manipulation leads to distrust, fear, and that has these terrible mental health downstream effects. And even before COVID, we had a mental health epidemic. We have not enough mental health practitioners. We have people that are just being put on drugs that don't really work. The real intervention for mental health is lifestyle modification, right? Not everyone has schizophrenia and needs some hardcore drugs. A lot of people are just depressed and anxious because life is hard. And we live in this bizarro world that's not consistent with our ancestry. And so, you know, when we launched Sapien years ago, that was our motivation. And now we've just made things worse as a society by not being honest about COVID, not being honest about our general health as a society, our metabolic health. We're not honest about the effectiveness of our interventions in the world of Western medicine. And it's just demoralizing for patients because they don't have anywhere to turn. And that's not going to change anytime soon. So we're going to keep talking about it on here. We're going to keep pushing people to join our Sapien tribe and learn about our recommendations, because those are meaningful intervention. It's not just low carb, right? It's not just fasting. It's understanding that your health is driven by your lifestyle, and that we don't even have meaningful recommendations for lifestyle. Like through my training, and most doctors, they don't have a good approach to lifestyle. They don't have a meaningful approach to weight loss. They don't have a meaningful approach to diabetes management. All they have is drugs and the standard American diet. And it's been failing us for decades, and now it's really failing us. And now over the next few years, they will not be able to hide the fact that the real fallout of COVID is not just the deaths that COVID causes, but the morbidity and mortality that our social policies have caused.
It's sad. It's sad. We kept saying it. The cure could be worse than the disease, and there's just so many things we can get into. So we'll end it here. We like to keep these short, but I guess I'll end on just encourage people to look at the other side. You know, there's another side that you hear in the news. Maybe this episode is something you can share with friends and family, because we're too extreme. You know, I've seen some people online that are completely like, there is no virus, like COVID's a scam. And then there's people that are like, I'm going to stay in a mask and indoors for the next 10 years. And they're serious.
And both are extremely bad strategies, right?
Yeah.
When I'm told on social media that like your testing is terrible and testing is all bad, or you know, then I hear from my patients, I haven't left my house for a year. You're not helping anyone. You're falling prey to this us versus them mentality, this black and white approach to health, and even with nutrition, right? Like our whole approach is the Sapien diet and lifestyle encompasses many, many nutritional approaches. We don't even bash plant-based. We're just trying to say animals are really, really healthy, and they're the most nutrient dense and sort of inherently healthy.
Sure, yeah.
But, you know, I have plenty of patients that are eating 10 or 20% animal products and other plant products. And what we do is the rest of plant products. And what we do is we talk about, hey, don't buy the plant slop, buy like real healthy plants and support local agriculture and all this stuff. But, you know, people need to be more thoughtful. They need to stop being mad at each other. They need to realize that everyone's in the same boat. Everyone's scared, and everyone wants to get back to some kind of sense of normalcy. And instead of yelling at each other and staring at someone like there's some kind of crazy asshole because they're not wearing a mask when they're on a run and there's no one around them, like, you know, we have to be more thoughtful and loving to each other, and start rebuilding our society as a unit instead of breaking off into factions, right? When we talk about tribalism, we talk about having your own little internal tribe that supports you in your lifestyle. But on a grander scheme, America is its one big tribe, and really the world. We live in a global world. We're humans. We're all together, and we need to like bond together and not be divided, and
Mhm.
constantly angry with each other, because it just makes things worse.
Yeah, yeah, and that's it's all good stuff. And I was gonna finish my thought of, yeah, there are these extremes, and I think this episode is good for Dr. Gary to come on, and there's a nuance, there's something in the middle with everything, with how we're handling COVID, the lockdowns, with the vaccine. So it's good for people to hear the other side to things, and to not just think this is how I am. Like, I'm on the left and I'm this, and I'm on the right, and this is, it's like, this is how I identify, or this is what it's so funny how, because I'm on neither side. I think they're both equally as bad. I think all the media is equally as bad. I think all the politicians are equally as bad. I guess I'm just against it all. But so I'm definitely not on either side. But it's just funny that so many people just have to fall in line to everything that one side believes. And that's just crazy. And that, yeah, look at both sides, see, where the holes are in either side's ideas. um yeah, I mean, I think we should
I've
just
said
end it
it
here.
before, I've said it again. Be thoughtful. Be thoughtful. Don't buy what's sold to you. Use your brain, think for yourself, and you will live a better life.
Yeah, I love it. I love it. So that's it. Yep. Share with the family, friends. Subscribe on the Food Lies YouTube. Subscribe on your podcast app to Sapien. I'm going to Africa. This is probably coming out when I'm in Africa. I won't have the Peak Human podcast for a while, but you can join the tribe. We're doing stuff there each week. I'll pop in there, nose to tail, get all the meat products. We got a new seasoning, and book something with Dr. Gary online if you aren't around, or if you're in LA, Evolve Healthcare.
Thanks, Brian. Thanks for listening, everyone.
All right, we'll see you next week.